Right. It actually starts from very early in the age, when a child at the age of 3 to 5 months of age has to give me a social smile back, isn't it? If a child is missing on any of the early developmental milestones, you said that what is missing? Missing is that a young parent, recently married, don't know anything majorly, they don't know about the developmental milestones of a child in the first few years of the life, because they are so busy in their work, and other things are their new marriage has happened. They are not being given the information about early milestones checklists. That is where a role of a pediatrician comes into play. Whenever, or a gynecologist, when a child is born, there should be a checklist, or there should be a pamphlet in the hand of a young parent who is given the developmental milestone tracker, so that a parent will be able to see that from 3 to 5 months of age, if my child is not following objects, if my child is not maintaining eye contact with me, if my child is not giving me social smile, I'm smiling at him or her, he or she is not giving me that social smile back. If the child is not able to respond to different sounds, these are called early red flag signs in a child, which might result in any kind of a developmental delay or a developmental disorder, which can be autism spectrum disorder. In fact, we have seen in our clinical practices at Child Development Clinic that when young parents who are well informed parents bring their children early, for example, at the age of 6 months, and they raise the concern that my child is not giving me eye contact, or my child is not able to pay attention towards my facial gestures, these are the kids who can be picked up early. Even if the diagnosis is done by 18 months of age, we don't need to diagnose a child and wait for the diagnosis of autism spectrum disorder. This is a very, very important thing, because most clinicians, many parents think that if the diagnosis is not done till 3 years of age, we can wait and watch. That is where we miss the golden period of 0 to 3 years of early intervention, and when the brain development of 90% takes place by 5 years of age. If the red flag signs, not following instructions, not looking at me, not giving me social smile, poor joint attention, means if I'm pointing to something, child is not able to look at that and look back at me. There is lack of sharing of joy and excitement. And if he or she is not able to register a caregiver, if there is no separation anxiety, or for example, if they don't have this stranger anxiety, sorry, and these kinds of milestones can be tracked. If any of this is missing, we don't say
Certainly.
that we don't say that every child will be looking at me at 3 months of age and smiling. No, it can be. There is a range from 3 to 5 months. There is a range for a child from 10 to 14 months, that my child should be able to speak first meaningful word. When I say meaningful word, it means it's not like pa pa pa. No, it is like only directing or labeling his or her father as papa or mama. This is called a meaningful word utterance. Usually, we have these myths that boys speak late, so we can wait for it. This is an
Absolutely. I
absolute
think
myth.
that's
Yes,
very important. In India, what we generally see is अभी बच्चा है, थोड़ा बड़ा होगा तो शायद ठीक हो जाएगा. Mr.
बिल्कुल
Sharma,
बिल्कुल.
when was the time that you got to know that your child is autistic? Over the years, if you could take us and our viewers through how your experience has been, and especially if you talk about the last 2 years, how did you help your child cope up with the pandemic?
Yeah, since actually I am part of the Indian Navy, so my son was born, I was posted in Visakhapatnam. And I agree with Dr. Noorani that the perception, in fact, the doctors also said, since he's a boy, boys take time.
Yes.
So in that way, we were very relaxed. Okay, with time he will recover, or maybe he'll start picking up things. Then I was transferred from Visakhapatnam to Delhi. That is when we actually the actual diagnosis happened, and we came to know that he's autistic. So I fully agree that this general perception, it goes on. Boys take time, and girls are very fast. It happened in our case also. Maybe if the intervention had started earlier, the things would have been different. Maybe.
Yes.
And as the second question that you were asking, last 2 years have been very, very challenging and very difficult, because like both my son, actually, he is in a hostel since he is the only child. So as per the doctor's advice, since he does not have any sibling, so he was developing different behaviors after coming back from the special school. So we had put him in a hostel.